How you doing? I'm still a clinician. What's up? What's your name?
That's all.
Today we're going to be doing some orthopedic tests. If anything hurts, please let me know. Any questions, feel free to ask, and maybe begin.
Yes.
Okay. So for the first one, we're going to do a meat sign. So can I just have you take your chin and place it down to your chest? And a positive would be shock-like sensations to the extremities, which would indicate spinal cord degeneration, spinal cord injury, or spinal cord inflammation. The meat sign is, can I have you lay down? And we could also do a meat sign like this. We're going to do Kernig's test. Can I have you lay down? I'm going to lift your leg. I'm going to go 90 degrees. Just now I'm going to straighten it out. Cool. And a positive would be the inability to straighten the leg or pain in the neck region, which would lead to meningeal irritation or meningitis. So the next test is Budinsky's test. I'm just going to have my hand on your neck. And positive is involuntary knee flexion. The indications are meningeal irritation or meningitis. Now I'm going to demonstrate tests for the cervical spine. The first test is going to be the solo hold test. I'm going to ask my patient to lay down. Can I have you cross your arms? And I'm going to contact your arms in behind your neck. Is that fine?
Yes.
Probably pressure. Good. Good. And the positive is pain in the cervical area, possibly down to T2. The indicators is a non-specific test for the general integrity and structure of the cervical spine. Now we're going to do called Sullivan's maneuver, and we're checking for space occupying lesions and then tracking of nerve roots. So can I just hold you, continue the tech, can I take a deep breath in and squeeze all the way up? Good. So the positives will be radiating pain from the spot of lesion, and this will indicate nerve root entrapment by this lesion. I'm going to be demonstrating tests for foraminal encroachment. Foraminal compression test. I'm going to just have you sit up straight, and I'm going to press down on your head. If the patient has localized pain, then the positive will be foraminal encroachment and facet entrapment with no nerve root compression. If the test is negative, you will have the patient head just rotated in the same test. I'm going to do Jackson compression test. Can I have your head lat reflex? I'm going to just push down into the top of your head. And the opposite side. And the positive would be for local and radiating pain. For local pain would be foraminal entrapment with facet pathologies with no nerve root compression, and radiating pain would be foraminal entrapment with facet pathologies with Now we're going to do maximal cervical compression test. I'm going to passively lateral reflex, extend patient's head. And the positive would be pain on the concave side. And if there was local pain, there would be foraminal entrapment with facet pathologies with no nerve root compression. And then if there was radiating pain, there would be foraminal entrapment and facet pathologies with nerve root compression. So now we're going to do cervical distraction test. I need to place my hands on your mastoid.
Yep.
Now I'm going to lift straight up.
All right.
And the positives are absence or diminished pain in the lower area for the cervicals, which would be foraminal encroachment without nerve root compression. And then it'd be absence or diminished pain, radiating pain in the cervical, which would be foraminal encroachment with nerve root compression. And then there'll be increased cervical pain, where it'll be muscular strain, ligamental sprain, and facet facet capsulitis, and myospasms. I'm going to do Bacody's sign. My patient came in with radiating pain on the right arm. I'm going to ask my patient, can you just take your arm and place it on the top of your head like this? And the positive should be decreased pain in the radiating right arm. And this will lead to foraminal entrapment or nerve root entrapment, usually in the C5, C6 level. This test is used to raise the subscapular and also take pressure off of the upper brachial plexus. So now we're going to do Addison test. May I find your radial pulse?
Yeah.
Good. Can I have you lift your head and look towards me and take a deep breath and hold? And look to the opposite side. Still forward. Good. And the positive would be decreased or absent pulse with pain, pallor, or paresthesia in the arm. It indicates compression of the neurovascular bundle by the scalene atticus or the cervical ridge. Eden's test. So can I find your radial pulse?
Yeah.
Okay, I'm gonna just bring the arm up. Alright, and I'm gonna have you sit straight up, bring your chest, and bring your head down. And take a deep breath and hold. Thank you. And the positive would be a decrease or absence of radial pulse, pain or pallor. And the indicators would be compression of the neurovascular bundle by the clavicle and the first rib. Wright's test. And can I find your radial pulse?
Yep.
I'm gonna lift you on the way up. So.
Okay.
And the positive is absent or diminished radial pulse with pain, pallor, or paresthesia. And the indicators are compression of the axillary nerve by the pectoralis minor and the coilocoid process, which is the thoracic outlet syndrome. Now we're going to be demonstrating tests for the ulnar nerve. The first test is going to be the Tinel elbow sign. So can I have you just have your elbow up like this? One time for the ulnar groove. And the positives would be pain or tenderness in the ulnar nerve, or paresthesia in the ulnar nerve from fingers 4 and 5. And the indicators would be neuroma of the ulnar nerve. I'm going to do the foramen paper sign. Can I have you go like this? I'm going to place the paper here. Can you hold the paper? And that's one positive, the inability for the patient to hold the paper. One more time. And that's another positive. The thumb is used to recruit as a recruitment device to hold the paper. And this would indicate ulnar paralysis, which would lead to weakness of all ulnar innervated muscle. Now we're going to be doing tests for the median nerve. So I'm going to ask my patient, now we're going to do Phelan's test. I ask my patient to hold his hands like this. And they will hold for 60 seconds, but you can relax. So the positive would be reproduction of pain in the first 5 digits of the fingers, which would lead to median nerve neuritis, median nerve entrapment, and carpal tunnel syndrome. So now we're going to do prayer sign. So I'll ask my patient to hold his hand like this, and we'll hold it for 60 seconds. You can relax now. Positive would be reproduction of pain in the first, second, third, and lateral half of the 4th digit, which would lead to neuritis and carpal tunnel syndrome. And now we're going to do Tinel's wrist sign. I'll ask the patient to hold his hand up, and I'm going to tap in between the thenar and hypothenar eminence. And the positive would be same as pain in the first, second, third, and lateral of the 4th digit, which would be median nerve neuroma, neuritis, or carpal tunnel syndrome. So now we're going to be demonstrating tests for the thoracics, and we're going to start with Adam's sign. So I ask my patient to stand here and just stretch all the way down, touch your toes, and back up. And usually this test is done with patients with scoliosis. So the positives are, so if the spine, if the scoliosis straightens, then it would be a functional scoliosis, which would have subluxation or trauma. And then if the scoliosis doesn't straighten, then it will be a functional scoliosis. So now we're gonna do beaver sign. So I'm gonna ask my patient to have his hands crossed against his chest like he is, and then do a partial sit-up. Good, and back down. So the positive would be superior or inferior movement inside the umbilicus. For superior movement of the umbilicus, of the spinal cord lesion at level T11 to T12 or low abdominal weakness. Inferior movement of the umbilicus is indicative of nerve root involvement. Alright, so now we're going to do Schleppman sign. I'm asking the patient to sit all the way up, sit straight up, and raise your hand straight up to the end, and can you laterally flex your whole body to the left, and then to back up, and then to the right. And that's fine. And the positive would be pain on the concave or convex side. Pain on the concave side indicates intercostal neuritis or thoracic dermatomes can be evaluated on the corresponding intercostal spaces, while pain on the convex side indicates fibrous inflammation of the pleura.